Thank you, Mr. President. I hope I'm audible. All protocols observed. I come to you first of all as a person living with HIV from South Africa. So this conversation is not something distant to me, it is something I live every day. And I think the moment we are in today really requires us to reckon that the fight against HIV is not over. We have only 5 years to 2030 as a goal that we all set for ourselves to achieve sustainable development goals, to end HIV as a public health threat. But today, our partnership in the Global Fund and those we work with on the ground in countries, we need to reiterate that this goal is still feasible if we are all going to come together and realize that we need to come together at the moment when human rights and gender equality is being put into question as a value. But to get there, we need to ensure that we do whatever it takes to respect, protect, and promote human rights of people who are mostly vulnerable to HIV, and those of us, like me, who live with HIV. But we've come a long way. For the last 2 decades, we already can point significant progress in terms of the HIV response and what we have achieved. This is thanks to a steadfast commitment of member states in this room and those not in this room, communities who are not in this room, civil society who are not in this room, and technical partners. We have cut new infections by 61%. We have cut AIDS-related deaths by 73% in more than 100 countries where the Global Fund invests. This is something to be proud of. But we can go even further in the next 5 years if we really are focused in ending HIV, but at the same time also reaching our goals on SDGs. We must build on this progress, otherwise all our efforts will be in vain. By sustaining all investments currently, by also increasing efficiencies, strengthening our efforts to tackle human rights and gender-related health barriers. We know that to end HIV, it's fundamental that we invest robustly in the best tools to control and eliminate HIV. But even more importantly, we know that innovative biomedical tools will fail if those of us who need access to services don't access services. Because if we do not dismantle human rights and gender-related barriers to prevent certain populations and deterring people away from accessing services, we will not reach our goals. We must tackle these deep inequalities, but also underlying inequities in terms of health outcomes for some of the populations. Our work in the Global Fund is really important at the time when we need to really think about removing more and more barriers to human rights and gender inequalities, more than ever today. We have seen significant increases in some parts for some populations in terms of stigma and discrimination, reversal of some laws. Some countries really have been doing amazing work in reversing some of the laws that are harmful, but also we are seeing some of the clampdown in the civic spaces. That then means that more than ever we need to amplify the required scale-up of programmatic responses and ongoing action in this area. At the Global Fund, we invest in building systems that are resilient and sustainable to enable people to overcome these barriers at country level. But that still remains one of the key things we do in the Global Fund as at the center of what we are doing. That has not changed. For example, our Breaking Down Barriers initiative, which was launched in 2017, will continue to deploy catalytic investment, long-term implementation support, evidence-based, country-led action to address human rights barriers in countries. More than 24 countries we are supporting on this work. And 9 of those 24 countries, some of them are in the room, they are members of the Human Rights Council, and we will continue to contribute to ensure that we use a human rights evidence-based programming to ensure that the investments done in countries can take us a long way and we can see the impact. The second thing I wanted to address in my address is we are also doing work to ensure that we protect human rights in settings that are in crisis, in settings that are transitioning, in really challenging environments who are hit by disasters. And we know that conflict can lead to human rights abuses. It can lead to sexual and gender-based violence, which further intensifies the risk for vulnerable populations. And to ensure that affected people by conflict can continue to receive services remains one of the important things. We have supported community-based work and community-led organizations in delivering services, but also integrating human rights and gender equality work and programming as one of the immediate things that needs to be done in terms of the long-term sustainability in countries. For example, in Ukraine, we have the second largest HIV epidemic in Eastern Europe and Central Asia, and is also one of the high burden countries in terms of TB. We've deployed more than $27 million in emergency funding on top of the existing allocation. We have supported community-led human rights programs, collaboration between the Ministry of Health, the local community-led organizations that have contributed and maintained HIV/TB services and access for the most marginalized and vulnerable groups. And this is not just only in Ukraine. Examples in Kyrgyzstan, in DRC, community-led human rights programming such as peer paralegal support that educate key populations about their rights, play an important role in resolving some of the challenges on the ground, particularly around mediation, that have also demonstrated effectiveness. Because of time, I'm going to say a few things as ways in which we can strengthen domestic funding, especially in this moment where we've seen disruptions in the flow of resources to countries to ensure protection of access to services, but also protection of human rights. Strengthening sustainability requires both investments in reducing the burden of disease, the impact for those who are mostly affected, while at the same time supporting countries to think about greater financing and responsibilities for the epidemics. The Global Fund takes a comprehensive approach to sustainability. We support scale-up and equitable access to new technologies and supporting countries to develop strong sustainable and transition plans to gradually support countries to full leadership and fully owned national responses. And with those words, I want to end by saying the global strategy provides an important framework for action, and it is important more than ever now that we do not take our foot off the pedal and accelerate so that we can really touch 2030. Thank you.